Hello everybody, this is Thigh Company here. Welcome to today's live stream. Today is October 3rd, 2023. Hope you all are having a good day today. And today's episode we're going to be talking about health update, October 2023 health update. And first we'll start with the most pressing matter, most important matter, is regarding my grandfather. He is currently in the hospital and he had a bunch of different things happen to him lately. This all started off recently with about, well, give or take, maybe about last November or so, about a month after I was sick. We went to the doctor, and as usual, when visiting your doctor for regular checkup, uh, he did some blood work, and in the blood work, they found that he had a low hemoglobin, and he had a history of having a low hemoglobin, which as a result, doctors suspected that he may possibly have internal bleeding. So they decided that they wanted to do some work to see what's going on. So they decided that he needed to do an endoscopy and a colonoscopy. And for those of you who do not know what that is exactly, what that means is that they are doing a two different procedures here. First one they did back in last April, and that's where they use a tube. Or here we go. An endoscopy procedure involves inserting a long, flexible tube called an endoscope down your throat and into your esophagus. A tiny camera on the end of the endoscope allows views of your esophagus, stomach, and the beginning of your small intestine. And colonoscopy goes pretty much the opposite end. So with the endoscopy, they did not find anything, and then they did a colonoscopy last September, or yeah, a month ago, beginning of the month, and when they did a colonoscopy, they found in his colon, in an area called the cecum of the colon, that he had a cancerous growth. I think this was like 3 by 4 centimeters, and they decided that after consulting an oncologist and also with a surgeon, that it would be best to go ahead and, through surgery, cut out that cancer. And they did that. Let's see, today is Tuesday, about to be Wednesday. Last week, let's see what that would have been, the 21st, I believe. He came in Thursday, Friday, and then had the surgery 23rd. And on the 23rd, because he had the surgery the morning of the 23rd, and surgery went well. Everything was good there. After the surgery, I believe he had 2 days of clear liquid diet, which is usually like soups and that sort. And I believe Thursday the 26th, I'm sorry, I'm looking at the wrong calendar. I think I caught that. So this would have been Monday the 25th, 2 days he had good. So Thursday 28th was when he started back on his regular diet. And first day was well, everything was fine. But the 29th is when we started getting into some trouble. I remember myself and my grandmother going to see him or to check up on him on around noon on Friday the 29th. And we noticed two things that were concerning. First one was that his abdomen or stomach was bloated, and the medical term would be distended, I guess, in this case. And he also had a very kind of a poor change in his voice. It was, I think the word is harsh, or what's the word? I think it's like a harsh voice. We had somebody complain to explain it to us that it sounded like gargling when he was breathing, and we called over my mother. Mother came over, and I left the hospital, and my mother and my grandmother were there, and they were trying to resolve the matter, and they called over a respiratory team, and the respiratory team was essentially beginning to take a look at him, and then his surgeon came in again. Surgeons believed that there was a fluid buildup in the stomach, and which they believed that kind of combination of the stress. Also, there was a belief that he had mucus in his esophagus. That was what was affecting his breathing. And from my observation while I was there, kind of during the morning, was that to me it seemed like it was getting worse and worse. And one of the comments I heard from the respiratory team was, "Why haven't you given him Lasix, which is a medication, diuretic, which is, I believe it's also called furosemide. Um, but essentially, what it does is it helps you pee out the additional. From there, what they did was, they're going to suction out that mucus that they believe was in his throat. Um, after they did that, he was getting worse and worse, and his voice sounded clear, but he was beginning to kind of like choke. And from what I understood, was what happened was kind of with the respiratory team, with the liquid that was in his stomach, it went up and into his lungs, which is why he was choking. And he stopped breathing, and they came in to help out and figure out what's going on, and they started essentially helping out. When someone stops bleeding, they do everything they can to get the person to start breathing again. And he coded, or essentially his heart stopped. ICU, intensive care unit. And in the intensive care unit, when they were moving him again, or transferring him from bed to bed, his heart stopped again, and he coded again as a result, and they again began the same thing over again. During his code blue, they administer CPR, they use medications, and again they saved him a second time. And from there, you can imagine, the amount of stress, and him basically almost dying twice, and how critical a situation like that would be, and how stressful, and all the emotions that go on with that. Thankfully he's still alive right now. But later in the evening of the 29th, we first noticed that his blood pressure was extremely low. When I was there, when I came back later around, I believe, 10 o'clock, he was somewhere around, I believe, 60/30 in his blood pressure. In comparison, regular blood pressure would be 120/80. And, with medications, slowly, they began to raise his blood pressure. And, right now his blood pressure is fine. And they put him on a ventilator for his breathing. So he's basically right now, currently on a ventilator. And he's hooked up to different IVs and all kinds of stuff going on. And he's, on sedatives, basically make you asleep, so he is unconscious. I believe it was yesterday or day before yesterday, they were doing some breathing tests, and his breathing was getting better and better. And one of the other things that happened was that they decided to do like 2 different exams to see whether or not they can take him off a ventilator. And he passed both of the exams. He also, when they did testing to see if, whenever your heart stops, it affects your brain and whether or not there was any brain damage. And it appears to be that there was not any brain damage, and they, had him awake or conscious, and he responded to commands well. He recognized who was in the room, understood who was in the room, and he would respond to commands like yes or no, and he would squeeze his hand as a way to say, yes or no. And he would ask questions, hey, are you in pain? And he could say, squeeze yes, squeeze his arm for yes. And, does your head hurt? And you would, could squeeze his hand for yes, but his head did not hurt. So we believe that his head is fine, or there's no injury to the head or brain or anything to that area. Does his stomach hurt? Does his leg hurt? And he was able to move both of his arms, and I believe both of his legs to the extent that he could do, which of course in that given situation would be very difficult to do, but he's able to do it. However, which the later development that occurred was that he's had very poor urination or urinating, and for example, he is supposed to, at a minimum, produce 30 cc's or 30 milliliters avoidance of urine, meaning that that amount of urine is supposed to come out of the body within an hour. However, he was only producing about maybe 5, and then with different medications it went up to 15. One time it went to 25 milliliters or so. So right now the current plan is they're going to use different medications to see if they can bring up his urination to a better level. And we'll see how that goes. Let's see. I see a question here. Thigh, do you got an available room to stay in? I don't know what you mean by that. Like, they do let visitors come in and see him, if that's what you're asking. So, of course, the 3 of us were able to go in and see him. So there weren't any issues with that in visitation, if that's what you're asking. So yeah, they're going to do a couple different tests to see if any medications will work and improve his urination. If that does not work, because we believe his kidneys may have been affected by different medications used during the Code Blue, and if medications do not work, they're going to start him on dialysis. We had a nephrologist. Nephrologist, for those who do not know, is a kidney doctor or kidney specialist doctor, and they'll start him on dialysis, which is basically cleaning of the blood to improve the kidneys, which I believe will help him out. So which is planned for tomorrow morning, so the morning of October 4th. And from there, we'll see how that goes. Which I think, in my mind, that he'll improve from there. We'll see how he'll do with breathing. We think that maybe they try to take him off a ventilator a little early. They try to, once he passed the 2 exams to get off a ventilator, they tried to get him off a ventilator, but he only lasted for about maybe 10-15 minutes before kind of choking again, and then again they re-put in the ventilator, and he's on the ventilator again. So we'll see how that goes. But first, the most important thing right now are improving the kidneys, and once that's good, next thing will be breathing. Otherwise, he has been able to produce bowel movements, which his surgeon said is a very good thing, which means that that system is recovering and doing well. The next thing besides that would be basically his recovery and recuperating and later finding out how long he would be in the ICU, or intensive care unit for those who do not know what that means. Uh, and we'll see how it goes from there, because, the whole time he's been in the hospital, it's been kind of tough, really. Like, we think he was doing well, before the surgery, with the surgery, after the surgery, up until sometime around the evening of the 28th or morning of the 29th. And then, of course, it got worse, and kind of summarize the whole thing. He coded twice, or stopped breathing, and then heart stopped twice. Then, brought back twice. He's now, my understanding, is stable. Other than, they trying to get him to breathe normally, and he was breathing normally, and then they did 2 exams, and he passed both exams. They tried taking out the ventilator. After 15 minutes after taking out the ventilator, he was unsuccessful in being able to stay breathing normally. And after the 15 minutes, they reinserted the ventilator. So, issues, again, his 2 issues being with his kidneys and with his breathing. We're, again, asking for everybody's, thoughts and prayers, and helping us, being able to get through this dire manner. And, of course it's tough, and we'll see how it goes from there. And, I'm optimistic that it's going to go well. But, we'll see how it goes. I'm hoping that, he recovers. Basically, dialysis cleans out his kidneys, and that begins to recover and get back to normal. Breathing will kind of coincide with that, or, it will probably get better at the same time. And then from there, begin to recover. I'm hoping he won't be in the ICU for too long, and will be able to transfer to maybe, like, I think what they call recovery or progressive departments. I'm not too familiar with that myself as to how that exactly works. And then probably once he's in this, like, recovery / progressive unit, they'll probably move him back to, like, a regular unit, and then we'll see how he goes at that regular unit. If he does well in that regular unit, you with physical therapy and whatever else will be needed, I think that he may be able to be transferred to a rehabilitation hospital. And we do have at least 2 in mind. One was kind of like near the center of Charlotte that we liked, and then there's another one south of Charlotte. I won't say exactly where for privacy. That also we are interested in too as another option, but preferably the one that's closer to where we live would be the one that's preferred. Here and there with some people, but I think it's something we can work with, and that it's able to be resolved. And, unfortunately, I cannot go into too much detail, as so far we don't have enough information really to say. But yeah, that's probably the one thing I want to talk about mostly for. And, my grandmother is probably who's been suffering the most, and my mother. I've been able to, kind of keep myself together somewhat. But of course, I'm concerned what the future would be like. And, you gotta stay optimistic, stay positive in this. But a lot of other signs I've noticed is a lot of people have been helping out. A lot of people have been saying their prayers already for those who know us and have been close to us. And we just ask you, the audience and the viewers, to do the same as well, the best that you can. And gotta stay strong. And we'll see how it goes from there. But yeah, guys, I just wanted to give you all an update pretty much about my grandfather. The thumbnail is a photograph of him. I don't know if it's the best photograph, but it's, I think, a decent one. I do have photographs of him in the ICU, which I don't know if it's safe to put on YouTube or not. I know some people may consider it to be sensitive, therefore I probably will refrain from doing that. But we'll see how it goes. I think that time is needed for everything to kind of rest and recover. But yeah, we'll try to give you all another update as to how everything's going. But otherwise, my grandfather's stable. I think he's going to do well, and we'll see how it goes from there. But guys, if you have not already, thank you all so much for watching the show. Make sure to subscribe, like this video, give the video a thumbs up, and also comment down below if you have any questions, or we'll see. We can answer anything, or if you have any perhaps recommendations for future videos, we do appreciate that as well. And we'll see you all next episode.